Good afternoon. I'm here presenting on behalf of the Hull Ellis Concussion Clinic. It's a rapid access clinic that's located at Toronto Rehab, and they opened the doors in 2016. And basically how it works is that patients are being seen within a week of their concussion. They're recruited from 7 different ERs across the GTA. And we're collecting a lot of data and looking at people prospectively, trying to figure out why it is that some people go on to have prolonged symptoms. So just a bit of background. While we know that most people that suffer concussion make full recovery, there is this 15% that go on to have more persistent difficulties. And we're really limited in terms of understanding who it is specifically that is going to go on to have those difficulties. So if we were able to better identify sooner in the course post-concussion who those individuals were, we perhaps could sort of target interventions and improve outcomes. A lot of the research to date has focused on athletes, and at the clinic we're seeing athletes, but we're also seeing a wide range of different etiologies of traumatic brain injury. So for this particular study, what we wanted to look at was looking at some cognitive measures that were done at 2 weeks post-concussion, and those are listed there. And then they were administered, the cognitive ones were administered at 2 weeks, as well as a psychological measure, the BSI, which is looking at anxiety, depression, and stress. And what we were wanting to know was whether these individual scores at 2 weeks would predict recovery, which was deemed at week 8 by a physician, and they were rated on an 18-point scale that looked at sensory, cognitive, and functional outcome to determine if there was any relationship there. And what we found was the majority of the cognitive tests did not predict recovery. We had one kind of odd finding in that individuals that actually performed better on a verbal learning task were more likely to be unrecovered at week 8. On the psychological side of things, individuals that had scored higher on the somatic scale were found to be 2.5 times more likely to be unrecovered at week 8. So from this data, it would appear that the psychological intervention, or the psychological symptoms, probably appear to be a better target of intervention. Thank you. I'm poster 7.